Hi guys, Brian Gleize here from the Scott Insurance Agency, coming at you with another one of my Medicare quick hits. This one is going to be interesting because we're going to talk about costs between Medicare Supplements and Medicare Advantage plans in a way that it's probably never been explained to you. This can be an aha moment depending on where the person on the other side of my desk is in figuring out the economics of their health care as they're receiving their Social Security and go on to Medicare. So let's go over it a little bit. We have our standard Medicare up here provided by the government. We know that Part A does our hospitalization and that doesn't cost us anything. We know that Part B does our doctor's office visits and that costs $144.60 a month for most people. Higher income earners, that might be higher. Lower income earners, that might be lower. But for our average bear like me, it would be $144.60. These numbers that we just talked about remain constant, whether we're talking about a Medicare Supplement or whether we're talking about a Medicare Advantage plan. The $144.60 a month comes out of your Social Security check no matter what plan that you are on. So we're going to start with Medicare Supplements first. And these are all 2020 numbers and we're just using this as an example. So on a Medicare Supplement, a plan that I sell a lot of is Plan G as in George. For 2020, if you had just turned 65, that would cost $141.75 a month. Times 12 for the year, $1,701. Now on a Medicare Supplement, you need a prescription drug plan as well. I just put $30 in for the drug plan. We can get them cheaper, we can get them more expensive. I like to use $30 as a middle of the road number. Times 12 is $360. Add those two numbers together and that brings us to $2,061 a year for a Medicare Supplement. $2,061 a year. So what you need to understand is that the monthly premium is $141.75 a month for a Medicare Supplement. You pay that every single month, whether you're healthy as a horse and working out, or whether you're sick as a dog and you're in the hospital and things like that. That's important to know, is that that monthly premium is constant and it stays the same on a Medicare Supplement. Now let's change gears and talk about a Medicare Advantage plan. The Medicare Advantage plan that I'm focusing on is a zero premium to my clients, okay? So if you are healthy, this particular plan doesn't cost you anything. However, at the time of services, whether it's an ambulance ride, a hospitalization, a specialist visit, there is money to be paid in co-payments, okay? So the Medicare Supplement is a pay me now. You're paying every single month, whether you're healthy or whether you're sick. The Medicare Advantage is a pay me later. It's a, I'm not going to pay any money until I get sick. So on the Medicare Advantage, the most important thing to know on this particular example that I'm giving you, there's lots of different examples, $2,900 is the maximum out-of-pocket costs that you could pay out of your pocket during the course of the year. After you've expended $2,900, your cost for the rest of the year is zero. It'll pay it all. So let's take a look at our bottom dollars. We know that our maximum cost on the Medicare Supplement is $2,061 a year. At age 65, we just qualified for Medicare. We jumped on the supplement. We chose Plan G. We added in a prescription drug plan, and it's $2,061 a year. We know over here that my maximum out-of-pocket cost is $2,900. So which is cheaper? Of course, it's a trick question. It depends on whether you're healthy or sick. Because if you're healthy, you live a healthy lifestyle, you'll definitely save money on the Medicare Advantage plan. You won't have to pay that $141.75 a month. However, if you're not healthy, you have some procedures already scheduled, you know you're going to have more tests, then the Medicare Supplement may be the way to go for that first year because you would only be out $2,061 versus the $2,900. So really, we're just looking at this from an economic standpoint. If I take it one step further, we know that your Medicare Supplement costs are going to go up. They're going to increase every year, all right? So as this price, $2,061, increases every single year, there will become a teetering point, all right? So to give you an example, I had a client that came in and she was on a Medicare supplement. When we added everything up, she was paying $3,900 a year for her health care. Divide that by 12, she was paying that per month. Now in this particular instance, I was able to show her by switching to a Medicare Advantage, we would be able to save her $1,000 a year automatically. Now the conversation isn't that simple. We had to look to see if her doctors were in network, if her medications were covered, if the Medicare Advantage plan worked for her. But what I'm saying is that since the price of the Medicare supplement goes up every single year, at some point in time, there will become a teetering point where it will make economic sense to switch over to a Medicare Advantage plan because of the comparison of the maximum out of pocket for the year versus what you're paying. So talking about this on a very high simplistic level. Another important thing to know is switching from a Medicare supplement to a Medicare Advantage plan, easy peasy, we can do it every year between October 15th and December 7th. Going the opposite direction, going from a Medicare Advantage plan to a Medicare supplement, not so easy. Typically you're going to have to pass medical underwriting, and you may or may not be able to do that. So hope this has helped. We have not talked about benefits of the plans or anything like that. We just talked basic economics. Am I going to be healthy? What does my crystal ball say? If I know I'm going to be sick, I might choose the Medicare supplement because I already have a heart condition and I know I'm going to need stress tests and I know I'm going to need to get my INR checked all the time or whatever it may be. There's reasons where you might choose a Medicare supplement, especially around the age of 65 when you first sign up. But then again, depending on your age versus the Medicare supplement cost, when you compare that to the maximum out of pocket on a Medicare Advantage, that might make sense as well. Guys, we're here to help. It's what we do. It's what we pride ourselves in. So give us a call at 636-456-8633. We'll sit down, we'll visit. In today's world, we can do it on the computer if we need to. We're happy to mask up and wear masks, do whatever we need to do to help you guys out. My name is Brian Gleize, 636-456-8633. This was your Medicare Quick Hit and talking about Medicare Advantage versus Medicare Supplements. Thank you. Bye-bye.